You know, I can see lots of messages on there saying, you're cooked.
MRI, knee. There is a large infusion. Hold on, what's going wrong?
Effusion just means fluid. Any injury inside the knee can create bleeding. The fluid collection inside the joint, that's what an effusion is.
There is high signal. What does high signal mean? I've got good Wi-Fi.
A high signal is not, as he says, it means your Wi-Fi is great. It means on MRI scan, where fluid should not be, for instance in bone, if bone on a certain type of MRI, what we call a T1, should look black. If we see white in the black area, that's high signal. There's a part there that says soft tissue edema. It all sounds very complicated, but actually all it means is swelling inside the tissue. So all of the other tissues that are not bone, we call soft tissue collectively. So these are the outside sort of hinge ligaments on the outside of the knee. So they give you stability when they're intact. And he's got thickening in those ligaments, because when these ligaments heal, rather than being nice and slim, they heal with scarring, and that scarring means they get thicker. He's either injured it before, or this injury is a few weeks or a few months old.
Patella dislocation and a lateral line patella and a likely tear of the lateral meniscus.
He's got a tendon that allows you to kick when you're playing football. He's dislocated patella. Dislocation actually means is when your joint is no longer in position. But at some point he's done a twisting type injury to the knee like that, and the kneecap slips out of position. So you can end up with a kneecap that actually stays out, but often as you injure it and it pulls out of position, it will actually relocate itself as soon as you straighten your knee, which a lot of people have the instinct once they hurt their knees to straighten the knee, and you actually find it's been out and it comes back in again. If you move something out of position that far, there's usually anchoring ligaments. There's something that holds this kneecap in position and gives it some stability. One of the big ones is called medial patellofemoral ligament. It's actually probably not the strongest ligament that holds it in place, and it's usually the first one to be injured. And you have to tear that for this to move out of position. Otherwise, you won't move out of position. But if you've got a meniscal tear, they do sometimes heal. In most cases, this is non-surgical, and it's rehab and good physio. As a regenerative medicine specialist, I often try and avoid surgery, but some indications need surgery.